Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Coming to the pathological part, or what happens or what is triggering this miscarriages in pregnant women. So as you can see here is a picture of the uterus. Okay, now I'll be explaining it to you in a detailed manner how each factor of PCOS can cause miscarriage. The first and foremost thing is hormonal imbalance. As you know, in PCOS, we have to follow the Rotterdam criteria, which is the pi category. What is pi category? That is PIE, the pi category. Okay, always remember the pi category for PCOS. P for polycystic ovaries in USG or ultrasonography, and then I for irregular periods, and E for excess androgen. So because there is excess androgen in polycystic ovaries or there is excess androgen in PCOS patients, what happens is that whenever there is excess androgen or excess testosterone in the body, there is another layer inside the uterus called as the endometrial layer. Fine. This endometrial layer usually thickens so that the uterus will be able to hold or implant the baby. The baby travels from the fallopian tube and gets attached to the uterus lining inside the uterus, okay, inside the body of the uterus. After it gets attached and the baby starts growing inside, okay. So what happens is that if the endometrial thickness is not as much as it's supposed to be, if it is thin, then what happens, as the baby starts growing, the weight starts, there is gravitational pull always, and the weight starts increasing and the endometrium is ripped off, okay. So endometrial thickness, if it is not as much as it's supposed to be, then there can be miscarriage. Why is there not enough endometrial thickness? It is because of excess testosterone or excess androgen in the body. And then we have insulin resistance, which is also a cofactor in PCOS, because PCOS means polycystic ovarian syndrome. Okay, so syndrome, it has a lot of effect on even other organs in the body. So what happens whenever you have insulin resistance, which is hyperinsulinemia? What happens? This hyperinsulinemia or this insulin resistance can trigger and cause to have a drop in the progesterone. So what is progesterone function? The progesterone function is to increase the endometrial thickness so as to take up the implanted baby and support it. Whenever there is low progesterone level because of a trigger due to hyperinsulinemia or this insulin resistance, what happens? There is a decrease in progesterone level, there is decrease in endometrial thickness, and then miscarriage happens. And then compromised endometrial environment. Because of the hormonal fluctuations, it can be because of increased E1 in the body, decreased progesterone, increased LH or decreased FSH, hyperprolactinemia. The endometrial layer is very, very sensitive to estrogen and progesterone levels. Whenever they are not in a proper manner, the thick and thinness of the endometrium will vary in different, it can vary and it can cause miscarriages. And then apart from that, oocyte or the embryo quality, whenever the egg is released, as much as the sperm quality is important, so is the egg quality also. Okay, the egg quality should be in a proper, it should be qualitatively good. Okay, so whenever there is PCOS, there is hormonal imbalance which can cause improper or poor quality of the egg to be released. Whenever there is poor quality of the egg being released, the embryo cannot form properly, and that can also lead into miscarriages. And then we have potential for poor fetal development. What is potential for poor fetal development? See, the growing baby needs certain level of hormones in the body. Whenever there is no proper hormones, whenever there is insulin resistance, there can be chance for diabetes, there can be chance for thyroid, and all of these factors can cause poor development leading to miscarriage or expulsion of the fetus. So you know how PCOS is affecting or triggering or can be called as the maintaining factor for an improper baby formation. So if you're someone who's suffering from PCOS, do not take it lightly. Please take a doctor consultation as soon as possible. And if you're planning for pregnancy, make sure you're making some lifestyle changes and you will be delivering a happy and a healthy baby. If you're someone who's experiencing female reproductive organ diseases, we have told you how homeopathy has a better shot at curing these diseases. In homeopathy, Fidicus Homeopathy gives you a much better shot at health. Here we have two kinds of consultation options. One is offline consultation option or in-person consultation option, and the other one is the online consultation option. If you're someone who's staying near the nearest branch of Fidicus, you can come and contact us in person or offline consultation. And if you're someone who's staying far away from us, you can contact us online either through audio call or through the video call. And after the consultation process and taking your case and investigating your reports, especially to online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying elsewhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us with any of your problems that you're suffering right now, you can contact us on this number, call us, WhatsApp us, or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's experiencing female reproductive organ diseases like PCOD, PCOS, dysmenorrhea, bulky uterus, it can be hemorrhagic cyst or ovarian cyst, chocolate cyst, endometriosis, adenomyosis, bulky uterus, as well as fibroids, Fidicus Homeopathy is the answer. Why? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the first one being we are already experiencing a lot of patients who are visiting our clinic and are getting good success rate in treating them. We have high success rate in treating them and curing these diseases. Apart from that, there is transparent treatment here at Fidicus Homeopathy. What do you mean by that? There is no gray area between the patient and the doctor. Here the prognosis is very clearly explained to you. The personal care here at Fidicus Homeopathy is top notch. How? We will be answering all of your questions and busting all of your myths. So if you want to treat yourself in a proper manner, if you are seeking for cure, if you are seeking for health, choose Fidicus Homeopathy.
Fidicus Homeopathy.